Welcome back, everybody. Today, we are going to begin with the third approach to person focused models of resilience. In this method, groups are framed from a general population with the goal of comparing resilient group to lower risk peers as well as with higher risk maladaptive peers. In this model, children were classified on two major aspects of individuals' life. First one being good outcomes on how well are they doing in life, and second one adversity or risk factors experienced by them. Let's talk about the first factor now, that is the good outcomes. On the basis of this, the general population group was divided into three categories: high, middle, and low. These categories were divided on competence based on their level of success in three major tasks for their age groups. These three tasks being academic achievement, how well they were following all social rules and regulations, that is, social conduct, and their social competence with peers. Moving on to the second factor, that is exposure to adversity now. Based on life histories of negative experiences such as death of a parent, marital conflict, violence, health crisis, etc., the group members were classified as average, high, or low on lifetime adversity. The classification on both the bases led to the formation of four groups. The first group, who were having low risk level as well as low competence. Second group, having low risk level but high in competence. Third group, having high adversity level but low in competence, which is the maladaptive group. And the last group, having high adversity level as well as high in competence, which is the resilient group, as is very well described by the table given here. The goal was to compare the resilient group with the maladaptive group, who had experienced the same amount of adversity but were not doing well in their lives. And another goal was to compare the resilient group with the competent group, who were doing well but had not experienced a lot of adversity in their life yet. It was seen in the study that there were only around 3 people who were falling in the first group who didn't face any adversity but was still struggling. Since it was an extremely small group, it was not a part of many comparisons. Now, there were some important findings from this study. The results indicated that the resilient group was very much similar with the competent group, who had not faced any adversity, and very different from the maladaptive group with which it shared high levels of adversity. Both the competent and the resilient group differed from the maladaptive group on a variety of parameters such as close family relationships, good intellectual skills, levels of happiness, planning and motivation for life, and much more. But it is also important to understand here that some members of the maladaptive group were late bloomers. This means that although they were not doing well until the age of 20, they turned their life around at the age of 30. Looking back at the history of such people, it could be observed that they started showing indications of improvement from a long time. They were a bit different from other members of maladaptive group in their planning and motivation for life. Thus, they showed a changing pattern over time. Therefore, although belonging to a particular group, there were changes which occurred in individuals' life over a period of time. Regarding this, we are going to have a discussion in the next session, as we will be beginning with pathway models of resilience. Today, we are going to conclude the person focused models of resilience. Thank you and have a nice day.